Hi, everyone, and welcome back to the Dear Asian Community podcast. I'm your host, Josie, and today I'm here with Dr. Song. Thank you so much for joining us today.
Thank you for inviting me, Josie.
Of course. So, could we just get started with a brief introduction of, what your profession is and where you currently work?
Sure. I am a gastroenterologist at Metro Health, Case Western Reserve University, as a gut motility specialist.
Mhm. Cool. So, what inspired you to specifically pursue gastroenterology? Did you always know that that's what you wanted to get into?
Not really. Actually, I was get a little bit confused regarding my career direction at different stages. I think I may have a more clear understanding of my past when I was a medical school student. At the first 2 years, I was even feel regret. That's why I'm choose medical field, because at that point, what I was truly passionate was like a computer engineering.
Mm-hmm.
And like in the medical school, a lot of things I need to memorize, which is really painful for me.
Right.
But I think during the third year and fourth year in the medical school, when I truly get time to contact with patient and see what they suffer,
Mhm.
what I can help them, and the research in the gastroenterology field, then
Mhm.
I starting growing my passion and feel this might be the path I can continue. And I'm also passionate, um, passionate for.
I see. Yeah, that's very good to know. And I think it's very reassuring for not just me, but also people watching, since I know we're all trying our best to find the best career for us. So now that you have discovered that career that you like, could you explain what a day in the life looks like for a gastroenterologist?
A typical day for me, for example, in the morning, I start with my endoscopy procedures,
Hmm.
which could be an upper endoscopy with a camera going through the mouth, looking around the food pipe, stomach, proximal intestine,
Hmm.
and then could be mixed with a colonoscopy, which is aiming to screening for colon polyps to avoid colon cancer in the future.
Hmm.
Normally, I get several procedures in the morning. Once I finish a procedure, I take a break for about an hour in the afternoon. I have my outpatient clinic, which I see the GI patients. A lot of time, the patient coming with stomach issues, bowel issues. Then I take time to talk with them and to see what kind of diagnosis could be, what kind of treatment could beneficial for those patients.
I see. Yeah, very interesting. So, when you work with your patients, what are the most common digestive disorders that you see?
The most common digestive disease orders in the GI clinic actually is a group of conditions we call functional GI disorders.
Mm-hmm.
Interesting, majority of these conditions which does not carry a true disease. That means by using the high technology, which could include endoscopy, colonoscopy, CT scan,
Mm-hmm.
blood workup, everything at the end of the day are normal. And those patients still came to see us because of their experience significance, like a stomach issue, bowel issue, feel bloated, abdominal pain, nausea, constipated, or diarrhea.
Hmm, I see. Yeah, so that's very interesting. And I know that you mentioned a little bit of the technology that you use for certain procedures, especially like for endoscopies or colonoscopies. So what do you think are the most promising research treatments or technology for the future of gastroenterology?
So first, we have to thinking about treatment-wise or diagnostic-wise in two folds. What we are currently available to diagnose and treat patients, which normally can include upper endoscopy or colonoscopy to make sure your stomach, your bowel, there was no inflammations, no cancer there,
Mhm,
no infections. And then once we know those data, we can, based on the data, to make a diagnosis.
mhm,
Based on the diagnosis, we do have data-driving approach treatment available. Some of the treatments may help with the symptoms.
mhm,
Some of the treatments may directly heal the etiology which cause the symptoms, such as inflammations.
mhm,
For the research, a lot of time is building on the data we have by current available diagnostic tool or therapeutic approach to those group of patients. Of course, there still a tremendous gap between completely heal or resolution of the disease
mhm,
and the current treatment. But that means a lot of patients might get into a space which none of current available treatments can be beneficial for their disease or symptoms. So that give a great space for research to keep kicking, for innovative technology to kick in,
mhm,
to grow, to help those unsatisfactory diagnosis or treatments.
mhm. I see. That's very interesting to hear insight. So along with that, instead of just the technology, I know that as a doctor, you have to kind of be a people person. You see a lot of patients on a daily. So how do you really approach teaching patients to the importance of changing their lifestyles or the importance of specific treatments?
That's a great question. I think one of the important points when we see patient, we need to listen well. What truly patient, what are those true concerns from patients?
Mm-hmm,
Very important. And to make sure patient and doctor like me are on the same pages.
mm-hmm,
Because the first normally what I would ask a patient when I first see them is what are the most concerning or bothersome symptoms for you in the daily life?
mm-hmm,
Because a lot of time, even patients themselves, they get confused. They can with a group of symptoms. Doctor, I do have constipation. I do have diarrhea sometimes. And I
mm-hmm,
also feel gassy, bloating, nausea. What happened to me? Why nothing works for me?
mm-hmm,
So you see, just a simple sentence with a lot of symptoms um, can be easily get confused. A lot of time I would start with if I wanted to pick one or two symptoms, what are most bothersome symptoms for you in the daily life? Then the patient starting dissect their symptoms. Ah, I think probably constipation bother me most,
Mm-hmm.
because often I just couldn't go regularly to have a bowel movement 3 to 4 days in a row. I feel truly bloated. I have decreased appetite. I feel nauseated. Then you see, here when you listen to them and when you ask them to complain, to tell us the most concerning symptoms, constipation is the key uh, culprit or the cause for generating the group of complaints of symptoms patients have. So my key target in this case is going to be to improve constipation, which is like a blocked pipe. There are a lot of ways to just keep the pipe not patent very well. So anything flowing in the pipe is just not face a lot of resistance. Then we need to have a daily more routine maintenance of the pipe, so that the stew can routinely cleaned from the pipe. The gas can be easily untrapped from the pipe.
Mm-hmm.
Then the patient will feel much better, less bloating, more appetite, less nausea.
Mm-hmm. I see. Yeah. So with that, are there any challenges with talking to the patients, and maybe what is the most rewarding part of being able to talk to patients and being a doctor in general?
Yeah, most rewarding part because each patient come to my clinic. I'm
Yeah.
the person to help them.
Right.
And when I see an issue, I feel I'm able to help them to improve their quality of life. That's
Mm-hmm.
my most exciting part. That's my most rewarding part. And I
Mm-hmm.
feel my patient, when they follow my recommendations, they get improvement. They get a symptom resolution of the disease. They're getting healed or treated for their disease. That's the most rewarding part for me.
Mm-hmm. I see. So, would you be able to share some advice for people who are still trying to figure out their careers and might want to pursue something in healthcare, maybe even gastroenterology in the future?
Definitely. I think for my experience, it's take time for me to sort out which career path I'm going to take for my whole life. It take a few years, or even when I enter into the medical school, I'm still confusing,
Mm.
get hesitate. Should I go to surgery? Should I stay in the medicine even, or should I go to specialty such as gastroenterology? I think, but one thing for sure is uh, not only me, I see a lot of my peers facing the same issue. They're hesitating, they get confused, but then once they figure out, they work hard, they
Mhm.
persevere in doing things. Even if they know gastro is their career, like a career pathway, they will never give up. They
Mhm.
will be persistent in working hard towards the direction, towards their career goal. So basically, never give up and to be persevere. I think that's the most important um, personality or my advice to the person who are still on the way towards their goal.
Mhm. Very good. Yeah. Thank you so much for your insight. It's very helpful to talk with you. That's all the time that we have today, but thank you very, very much for joining me.
Thank you. Thank you for inviting, Josie. Take care.